Welcome to Hope for Med.
Hope for Med. Hi, everyone. Welcome back to the Hope for Med podcast. I am your host, Dr. JB, and today's featured guest is Dr. Estela Mota, who is a board-certified family medicine physician working in Austin, Texas. Welcome, Dr. Mota.
Thank you. Thank you. Thank you for inviting me to your awesome podcast.
So, Dr. Mota, let's start from the beginning. Tell me your origin story. Why medicine?
Why medicine? Well, I'm from Venezuela. My parents are physicians, and I grew up seeing that world through my parents. Mm-hmm. My mom is an internal medicine doctor. She had a private practice in Cumaná, which is a small town in Venezuela. And she shared space with my dad, who is a pathologist. And so they both worked in the same clinic. And I grew up being there after school, afternoons, seeing them work, seeing patients, and working hard, being on call, visiting. My mom used to do house visits. So she would take me when I was after school. She would take me. I would play with her patients' kids. And so, it was very natural for me. I mean, like by the time I needed to choose a career, it was a no-brainer. I didn't see myself doing anything else. And actually, it seemed like it was the easiest thing to me. Like if I was thinking about doing engineering or, I don't know, architecture, I would feel like that was hard. But if I thought about medicine, it was like, oh yeah, that's easy. Mm-hmm. So it was very natural. I have also several uncles and aunts that are physicians in my country. So yeah, I grew up in a doctor's family, I guess. So it was a natural call for me.
And do you have any siblings?
Yes, I have 3 older brothers, and they are all engineers.
Oh, so that's interesting. So that's kind of interesting. So what happened? I wonder how they went down the path of engineering.
I don't know. You would have to ask them. But I was the only one in my household that decided to follow my parents' footsteps.
Did your parents encourage you to go down this path?
Not really. I mean, my mom never said yes or no. Mm-hmm. My dad actually used to tell me when I was young to not go into medicine because he thought it was going to be too hard for me. He didn't want me to struggle or to be on call all the time or things like that. So I remember him saying, no, you should do something easier. Okay. But I never paid attention to that. To me, it was easy, I guess.
It was easy, yeah. Okay, so then you decided, here I am. I'm going to be a doctor. Okay, so how was that journey?
In my country, we go to medical school very young. We finish high school and we go straight to our professional careers in training in the university. So we don't have anything like pre-med or anything in between. Okay. I started medical school when I was 16 years of age. So, I say it's natural, and I did all my medical school. It was good. I did well through medical school. I think that the first years of my career, as a normal 16-year-old, 17-year-old, I was actually more focused on friends and social activities, right? So I guess even though I was learning what I needed to learn, I kind of felt really passionate about the career later in medical school. Like when I was finishing and I was kind of facing professional life, that's when I really kind of felt really involved. At the beginning, it was just like going to school. It was not really, I didn't see myself as a full-blown doctor when I started medical school. And I think it's because of the age factor. But thank God, by the time I finished, I still felt like I liked what I studied. And so yeah, it went fast. I had a lot of fun through medical school, and I learned a lot. By the time when I was in Venezuela studying medicine, our schools were very good. The quality of education was really high. Right now, it has changed, but yeah, I felt like I had everything I needed and all the exposure and the right training.
Mm-hmm. Okay. And so you did your schooling in Venezuela. So when did you come to the US?
Yeah, so by the time I finished medical school, the situation in my country was a little difficult as far as the political and social situation. My brother had moved to the United States before I did because he found a job here, and he was transferred to work in a company here. And he was in Dallas at that time.
Okay.
And so because of the hardship in my country, my brother suggested, well, why don't you come here and try to apply for residency here in the States and see if you want to stay in America instead of practicing in Venezuela. So I took that advice. I was like, yeah, I'm going to go. So I came right away after completing medical school. I came because I obtained a student visa. Mm-hmm. And I studied English first, and I studied for the boards. And so it took me a few years to get all the boards done. And I finally applied to residency in 2011. Okay. And I matched in UTMB in Galveston. So I finished my residency there, and that was in 2014. So since then, I've been practicing family medicine.
So what did you do in between that time period when you got to the US and were studying for your boards?
It was interesting because when you come to this country with a student visa, you have to study. You have to have a full-time load of credits in a college. Mm-hmm. And initially, I was doing English, but it took me only probably a semester to finish the ESL classes for English. So after that, I had to come up with something, with a minor, like, a program to continue my visa, because I was not done with my boards by then. So I decided to go to nursing school, because that was the only short program that I could do. And I was very lucky, because when I started taking general classes for nursing, in a community college, you have to do psychology and anatomy and physiology and things like that. To me, it was great, because I was like, well, I'm studying for the boards. I'm not taking something totally crazy out of my field, so I can focus on my boards. So when I took some basic classes, I received a letter from the dean of the college saying, hey, since you have a 4.0 GPA in your basic classes, we have a scholarship for you to study any 2-year program. Oh, and I was like, wow. That's awesome. So I registered in nursing school. I completed the 2 years nursing school, completely paid. And I finished that. I worked as a nurse in a telemetry unit in Dallas, Texas. And then I matched for my residency. So it was kind of a weird loop, because I was a doctor that went to nursing school and then came back to doctor. So it was different, but it was very interesting, and I loved it. I learned so much of things that, even though nurses and doctors work in the same field, we never, as in medical school, we never pay attention to the things that they study.
That's
which
right.
are very useful to know about. I mean, patient care and the things that they have to navigate, and simple technical things that we don't pay attention to when we write orders and tell the nurse to do.
Right.
So I loved it. I think even though it was a long loophole,
Mhm.
it was worth it. And by the time I applied for residency, I felt so confident. I had so much more knowledge about the American medical system, because our country is completely different.
That's right.
And I think I needed that to feel, I'm good. I can apply to residency, even though I'm from another country with a different trade. I mean, it really closed the circle for me, I think.
Yeah, and I'm sure you were the nurse's favorite as an intern.
Yeah.
You know.
Yes, and I'm very, so far, every time I work in any place, I get along very well with nurses, and that has helped me a lot too. Because if you are best friends with the nurses, they got your back.
Life is so much easier.
Yes.
All right. So then you decided on family medicine. So was that always your goal?
Yes. I have always had a broad interest. During medical school, I liked a little bit of everything. I knew I didn't want any surgical specialties. I don't see myself in an OR all day long, being on call weird times. So to me, I think that because my mom was an internal medicine, primary care too, I knew what to expect, and I liked it. So, and I like kids too. So that's why I was like, okay, well, I can do a little bit of procedures. I can see kids. I can see adults and elderly patients. So yeah, I wanted to have all that scope.
Okay. And so how has life been since completing residency and now you're working as a board certified family doctor?
Yeah, it has been great. I've learned a lot about myself, a lot about what excites me from my career.
Oops.
And I have learned a lot about how practice is in this country. I've seen what I like.
Can you do me a favor?
Uh-huh.
Because the camera acted crazy.
Oh
So
yeah.
it
Let's repeat
got those lines when you said, when I asked you, how has life been since completing residency? So go ahead and start there. You're saying I learned a lot about myself.
Okay. So after I finished residency, it has been a great experience because I've learned a lot about myself as a physician. I know what excites me, what I'm passionate about, because, when we say I'm passionate about medicine, but that's a very broad statement.
Sure.
And I have, I've learned what really excites me about the relationship with that patient, and during that journey, what really tickles me and what really makes me strive to continue, right? And also I've learned about how the system works, what I like and what I don't like, what works for my patients and what works for me. And so right now, I feel like I have got to a phase where I am designing exactly how my practice is. Because when I started after residency, I went to a traditional BC clinic that catered to underserved populations. I was an employee. It was a private practice, physician owned, run by insurance billing. And so very busy, high volume practice, fee for service. And I spent there 6 years. And I have to say, no matter how much you love what you do, the design of your practice can make you or break you. And I was burned out by the end of the 5 years. So,
How did you know?
that gave me the motivation.
How did you know you were burnt out? What were you experiencing?
Look, I was mentally exhausted. I didn't even if I had a day off, Sunday off, I never felt refreshed or replenished in any way. I felt like I was going without stopping. And that's a perception that I had. I felt that my natural personality, where I'm usually very social and very curious about others, and I like to talk a lot, and I like to empathize with people. By the end of those 6 years, I was very cynical. I was not myself. I was like just blowing things off and wishing things would just get out of my way, which, I mean, again, I'm not like that, right? So I was becoming this exhausted, overwhelmed person.
Well, why do you think that was?
Okay, I have a lot of theories. Number one, the amount of patients that I saw didn't allow me to really invest in those encounters. I was I was rushing all the time, and I was doing things for the sake of closing the encounter at the time, instead of really reflect on what the patient needed. Okay, so that was very stressful for me, because I knew things were not right. I knew my patients deserved better, but I had to do it that way, right? So I was out of control.
Do it that way because of what?
Because in a traditional practice, you are forced, I mean, you to survive. In order for me to survive and get my salary and allow the clinic to function and survive, I had to see that number of patients. The insurance companies, fee-for-service medicine means you need to turn the units. You need to keep that room with new patients. The faster, the better, right?
Yep.
And that's the system. It's not because my boss wanted to kill me or like to make it miserable for me. I mean, that's the way medicine is and survives. Exactly. If you don't do that, the clinic collapses. There's no money, no revenue to pay for the physicians, no revenue to pay for the MAs and to pay the light and the services and the paper and nothing, right? The secretaries. So, in a way, you want to keep it up. You want to keep doing it because you think, well, I want to be a doctor. So I have to do this to continue being a doctor. So you lose control. Yeah. You lose your voice. You lose your ability to design what you want to do because you need to turn units.
Yeah. So how long did you have with each patient?
How long what?
How long did you have with your patients?
Well, we had 15-minute appointments. If there were new patients, it was 30 minutes, but most were 15 minutes. And from those 15 minutes, while the patient is checked in, the MA checks the vitals and everything is forms are signed and all that, the time that the patient has with the doctor is probably 8 minutes
to do.
What?
You have your notes also to do.
Right. Yeah. Exactly. Oh, no. I mean, my notes were done later. My notes were done after the 8-hour journey. Weekends.
On your time off, on your off time.
Off time. So I'm sitting on my bed finishing notes. And, because again, the system it's not designed taking in consideration that. It's just, if you don't have another patient in these 15 minutes, you have less revenue. And so that, and it's important to realize, I think I realized that it's not really that I was busy. Physicians, from the moment we go to medical school and then residency, I mean, we're used to being busy. We're used to being involved with medicine several hours and days and without days off. I mean, we're used to that.
Yeah.
But when you are busy doing something in a way that is not necessarily the way you want to do it and the way you feel is the right way to do it, that is, I think, what causes burnout, not necessarily the hours. Okay. To me, it was more stressful to not have control over what I wanted to do. Like, I wanted to do so much. I wanted to help so many people. But that doesn't matter. You have a system, you have certain limits. And if you don't respect those limits, everything crumbles. And so you feel like a slave. You feel like you are giving your blood to something that is not necessarily what your dreams are telling you, or your aspirations to do things have nothing to do with what you're doing. So I believe that was the worst aspect, that what caused my frustration and my exhaustion, And
you mentioned in the beginning that you discovered what it is that drives you. Can you elaborate on that a little bit?
Yes, I noticed that I've always been fascinated by human behavior. And when I talk to my patients in a conversation, I felt that both of us were present, and that the patient clearly understands not only what I was saying, but also they understand themselves a little better, right? That moment where you're talking to a person and there's a moment of clarity, that is what I strive to accomplish. Like every time, the aha moment, the excitement, like I crave that, and I anticipate, I expected, like I have an anticipation to have that moment with another human being. And
how long does it take to get to that moment?
How long in one time?
Yeah, when you're interacting with somebody, to
it
really
might take 2 seconds. It might take 2 seconds in the first visit. It might take 4 visits, longer conversations. It takes different times, but the moment I get it and I experience it, that's what makes me keep going. And that's what makes me strive to get there again, right? So I've always been very, I love to teach. And I discovered that I was very good at analogies. So when I talk to patients about diabetes and why they have diabetes, I try to make examples with things that they feel familiar with. Like I know, depending on what they do, their careers, or if they have kids or not, I try to make analogies with that. And because I learned that when I have a patient that leaves confused, I am uncomfortable. So that sensation of the patient to say, "Oh, I get it, doctor. Yes, I get it, and this is what I'm going to do," and I see that they really get it. That's what I look for. And so for many years, I base that skill into education, right? Like giving them more information, teaching them about, diets and how to exercise and information about sleep and studies that I have done on that. But over time, I started discovering that everybody has a different belief system that is what allows people to see what you're seeing. They have a way of perceiving life that is very unique to them, right?
Yeah.
And so I started being more curious about emotional intelligence and belief systems. And so I personally took some emotional intelligence workshops, and that's when I discovered, wow, I know a little bit more about myself. I know why I have these and these behaviors. And then immediately I started seeing that in my patients. And I was like, wow, if I could learn a way to open that clarity for them through the coaching aspect, then it will be a lot easier for them to see their status of their health and to understand what behaviors takes them to do what they do and what behaviors take them to always cheat on their diets even though they want to lose weight. I mean, all that. And so through the coaching world, for me personally, I mean, like I was coached. I learned how your belief systems affect every decision you do in your life and how you perceive life and how you approach disease and how you approach death and how you approach lifestyle changes. So I decided to go into a coaching training program. And I became a life coach. And when that happened and I started applying those concepts into my practice, that's when I started seeing transformations. I started seeing patients that lost all the weight they wanted to lose. I started seeing patients getting off medications and getting the happiness that they really dream of before. I mean, that's when I started seeing meaningful changes. And so that took me to where I am today. I designed a direct primary care practice where I coach my patients at the same time as I treat their medical conditions. And actually, I approach all the medical conditions through the lens of the coaching. So before I start talking about diet, I coach them through learning who they are. And I coach them. Yeah. So I love that. I think that if now in hindsight, I discover that I'm passionate about psychology, human behavior and human psychology. So probably if I knew when I finished high school what I know now, I don't know. I love medicine, but I probably would have gone through psychology at some point too. And I still have that interest. I don't know. I may go to psychology school and become a psychologist too. So I'm telling you, the whole experience all my experience since I was little has built my character, has built the person I am today, and I keep changing, and probably, hopefully, I'm a better person every single day of my future.
So, there's a big change between, what you were doing before and taking the jump to go into direct primary care. What happened, if you can pinpoint something that made you say, you know what, enough is enough. I need to do this. I need to go out and create my own practice and really, dive into direct primary care?
I don't know. I really couldn't answer that question. I woke up one day and I said, enough is enough. I don't know. I don't know if anybody can really tell you what happens, because I think it's like a progressive thing.
A
combination of things. And it's all about, when I coach my patients, I remind them that nobody does anything because somebody else tells them. Okay. When we take a decision to do, when we do something, it's because we took the decision. Yeah. We told ourselves, I'm doing this. Okay. So a lot of times we spend years hearing from others, you should do this. I mean, if you don't like it, why don't you open your own practice and blah, blah. And so I heard those things before I decided to go on my own. And not until I felt I was ready, I don't know, it's like a switch. I felt confident and I wasn't afraid. Yeah. I was like, okay, I'm doing it. How are you doing it? I don't even know, but I'm doing it.
Yeah, exactly.
Do you have money? I probably don't, but I'm not. I'm gonna do
it. Well, they say where there's a will, there's a way.
Exactly. It's the power of intention is everything. And when you have something in the middle of your eyes, in your mind, it happens. We materialize what we believe on, and so. I guess I was ready, and everything, thank God, everything has been very natural. Like everything developed very easily and in the right times. I think, again, when you really want something, you don't see much. I mean, there are challenges, but you don't see it as a wall.
And this is your own thing too, which also helps.
You see, I'm very busy now. I have to do locums because at this time I'm growing my panel, and in order to meet my financial needs, I have to do locums assignments. And that means, for your audience, whoever doesn't know, probably everybody knows in your audience because everybody's in the field, but whenever somebody needs somebody, I go and I fulfill that shift. And I have discovered what I told you. It's like, it's not so much that you're busy. It's not so much that the system is broken, which it is. The system is broken. Yes. Your perception of what you're doing and why you're doing it is everything. So I have my own thing. I'm designing my perfect, ideal practice on my own time, exactly like I want it. And that is gold. Like, that fills my life with passion and happiness. So if I have to do an assignment in a busy clinic like the one I was before, it's okay. I'll do my best. I'll try to bring whatever I think will help the patients the same way in the limits that I have. Yeah. Because I know there is a goal. I'm doing this because I want to keep working towards my practice that I know is going to help a lot of people and that is going to make me a happier person. So I'm busy. I'm working a lot. I'm juggling a lot of things at the same time. I have 2 toddlers. I have a husband that recently had a major fracture and is kind of disabled this time. It doesn't matter. I'm so happy in my energy tends to be higher, even though I'm busy, because I have a vision. Yeah. I have control over what I'm doing. Yeah. I decide what locums I take. And if I took it and they're paying me for my job, it's okay. You see what I mean? So again, regardless of the situation, learning who you are, learning what is your passion, and owning your skills, because now I know I'm a physician and I'm a coach and I'm a mother and I'm resourceful and I'm good on this and I'm good at that. So I own that. It's mine. And that's what I have to offer to the world. And I have control over. I decide when I use it, how I use it, everything. That takes away the burnout in my life.
Mm-hmm. That element of control, seems to be like the underlying theme. You have that locus of control over your life now.
Yes. Now I'm not a victim of, well, I'm doing this because I have to, because somebody's expecting me to do it and I cannot let them down. I mean, that type of mentality, victim mentality, I think is what is causing a lot of the burnout in our field and in any professional.
And also feeling like you have no way out, right? And that's not even no way out of your field, but, feeling locked in your mind and having no way out and not seeing how you can change your mindset to be able to change your situation.
Yes. And sometimes that is a learned belief. Mm-hmm. It's like a lot of times we think we have no way out. Mm-hmm. And not until you reflect on that on your own or through a coach or through a psychologist or through a teacher or through a role model that questions you and invites you to really see, hey, is that really true?
Yeah.
That's when we kind of wake up and see beyond that belief.
Mm-hmm. Mm-hmm. But you have to go out and find these people. You have to realize that I need help. Right. And H-E-L-P is one of the hardest things that we as healthcare professionals, one of the hardest words that we as healthcare professionals can say is, I need help.
Yes. And we have a opportunity as professionals that are sought by the community commonly. And like it or not, we tend to be an essential resource in the community. Like, everybody has a teacher. Mm-hmm. Everybody at some point sees a doctor. Even if they don't want to have a primary care physician, they may end up in an urgent care or in a one-time visit for something acute or whatever, right? So in a way, all of us in the medical field, the more we discover these things that we're talking about in ourselves, then we could, like you said, I mean, they might not know where to find it. So if you have the opportunity and the blessing to be around somebody else, the best gift that somebody can have is when you guide them to their own freedom, right? Yeah. And being a role model because you are free can inspire anybody that has the blessing to have you in their lives, right? Yeah. So I always think everybody that comes into my life, what is the gift that I have to discover on them? And what is the gift I have that I can give them? So the way that interaction is worth it, it's meaningful, and it's transformative for everybody.
Yeah, that's amazing. That's an amazing way to view things. So, Dr. Mota, if my audience member wanted to get in touch with you or wanted to find out more about what you're doing, how can they do so?
Well, I'm in Austin, Texas, and my website is www.mywavemd.com. And our office number is 512-761-6133. They can also find me on Instagram. It's MyWave MD. And actually, no, it's Wave _ medical. Wave _ medical.
Okay.
And so just if you Google MyWave MD, they can find my website. And I do recommend people to, not only doctors, to start thinking about taking control of their skills by taking the leap of designing their own practices. Right now, we have a lot of entrepreneurs that are thinking outside of the box and that are upset with the status quo, and they find ways to revolutionize the way they give their services. So that's how I found out about DPC, direct primary care, and I recommend physicians to check it out. Nurse practitioners also are checking it out, and for patients, or for everybody needs a doctor. So I would recommend to consider having their primary care physician being a direct primary care physician, because in that model, you have all the time in the world, you invest more time with your patients, you really get to know them. So it is it's high quality care that you get with direct primary care.
This is Hope for Med, new day for Med, for us, by us, and just for us. This is Hope for Med.